Hi everyone, I'm Dr. Gator and I'm here with my good friend, Dr. Cade from Rooted Apothecary. Really excited to chat with you guys and tell you a little bit more about Dr. Cade and Rooted Apothecary, which is one of my very favorite CBD companies, and I'm very excited for you guys to learn all about why I love this company so much. Thanks so much for chatting today, Dr. Cade.
Hey, Dr. Gator, thank you for having me and thank you for the time today. Just want to say again, congratulations on the summit. You put together a heck of a show and just, completely over-delivered. The value that you brought, the guests, the quality of that content, I think was life-changing for so many people. And so thank you for that. I appreciate it. And I'm excited to see what you're going to do next.
Oh, I really appreciate it. I mean, it was so much fun, and we really appreciate, you guys and talking about CBD, and Dr. Krick was on there, and he was amazing and just gave us a lot more information. Because, I get so many questions about CBD and hemp, and there's just so much controversy around it. And so it's really important, I think, to talk about these things, especially as it's becoming more mainstream medicine. It's just really talking about those fine lines, because there's certainly a lot of fine lines when it comes to CBD. So maybe you can tell us, before we get into any more, a little bit about your story and kind of Rooted Apothecary and what got you so excited about all this stuff.
Well, we were kind of talking before this, and I think that that's maybe a little bit of the boring part, right? I could talk all day about me, but to keep it short, I've been in practice in Naples, Florida for 10 years, opened up a practice with my beautiful wife. And, we've dealt with some health struggles of our own. My wife was diagnosed with Crohn's disease when we started having a family. And, I think one of the most important things for us is trying to get rid of what we maybe knew before going into that situation with her and her Crohn's disease, and turning the burden of that diagnosis into a blessing. It was a pretty rough spot in our life. We were, busy trying to open up a practice when she was diagnosed with Crohn's disease. And she, it was just an absolute horrible situation, and it was horrible timing. During that same time, my firstborn was diagnosed with colic, and we were going through our entire, quote unquote, natural toolbox to help these two. And we didn't really realize at the time how much they were really linked. But now we've, again, been able to take that burden of that diagnosis and turn it into a blessing and be able to help other people with some of the same situations. So again, I could talk all day about me, but been in practice in Naples, Florida for 10 years. I'm a husband for 14 years. My wife and I just celebrated 14-year anniversary, and we've got 4 kids now. And I think that's enough about me.
Awesome. You work with Olympic teams too, right? We were just mentioning that too. That's pretty cool. Are you still doing that?
So that was in the beginning part of my career before I had kids. That was something that was really important to me. I loved athletics. I loved sports. And if I couldn't do it, then I wanted to be around people that could, so I could live through them. So I was blessed to be able to work with some of the most talented athletes in the world. We worked with the USA judo team, the weightlifting team, the wrestling team. We traveled to the London Olympics. I even got to hold a gold medal. And I can say it is way heavier than I ever thought that it was going to be. But it was fun to celebrate, right, with some of the athletes. So now, though, my focus has shifted into working more with families and with kids, because, of course, that's, where my heart is, especially at home. And, just today I got to work with a 3-week-old little baby Parker, and who was struggling, again, with some of the same issues that my oldest son was dealing with. And, going through those things personally has brought, greater purpose to my professional career, a greater connection to my professional career, and again, a wider toolbox to be able to help those kids that come into our office.
Great. So I want to get straight into talking about the complications with CBD and hemp, because I've learned a lot about this now, and I read a lot about it, and there's just so much misinformation out there, and there's so much of a struggle in terms of promoting CBD, talking about CBD, what you can do, what you can't do, what the FDA says, what the FTC says, people getting in trouble, people not getting in trouble. And so I'm curious, as somebody who's really involved with this, if you can tell us about your struggles, because I think that why it's so important to understand this is because when people are going to make purchases, they don't really know all the backstory of all this stuff and what the difference of quality and where you go to is. And you might read something like, hey, this CBD treats blah, 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 blah. And there's a lot of backstory behind that and why some things say it and some things don't. So I'm very curious to hear about your experiences and all the probably horrible things that you've been through, because I just keep reading about all the horrible things that these kind of companies, your kind of companies have been through. So I'm very curious to know what you have seen and what you have experienced.
So I feel like I'm smiling on the outside, but my heart is racing on the inside. So, you know, for those of you that are listening, Dr. Gator and I kind of talked a little bit beforehand about taking this opportunity to be vulnerable and to be open and transparent, you know, with our listeners. So, you know, again, thank you for your time today and being able to share some of this stuff. And, you know, it is a big kind of topic to jump into. So I will start by saying, you know, Rooted Apothecary, I founded it in 2018. And, you know, after 10 years of practice, I really started to think, I saw a pattern with people in my practice. And I know that you see the same thing. I've talked with a lot of our colleagues about this. You know, unhealthy parents typically raise unhealthy kids. And those unhealthy kids typically turn into unhealthy adults. And that cycle is so hard to see. Or I'm sorry, it's difficult to break, right? And for us as practitioners, knowing how easy, you know, it is to change, it makes it hard to see, right? If that makes sense. So, you know, again, I started Rooted Apothecary with the goal of taking, you know, the 10 years of knowledge and experience and wisdom, right? And bringing that outside my four walls. If I can bless people in this office, how can I bless more people with that, right? How can I cut through some of that confusion and some of that unknown, you know, and CBD is just one topic, right? But essential oils and chiropractic and nutrition, but it's just, there's such a burden. And there's such a burden, you know, I know that you're a new parent, but when we had our first kid, there was, I don't want to say fear, but it was stress, right? There's a lot of stress of the unknown. You know, again, how are we going to discipline our kid? You know, how are we going to do sleeping? There's just such, you know, all of this. I see you giggling right there. And thank you again for putting on that summit so that we can cut through some of that. But it's incredible to see. And I knew something had to be done. I had to find a way to share what I knew and how it could impact families outside the four walls. So that's how Rooted Apothecary was born. So I'm a doctor first. I'm a caretaker. That's where my heart is. You know, I love sharing with people. I love giving them everything I've got. And, you know, whether they decide to do it or some of it, none of it, all of it, I don't care. That part's not up to me, but I want to give them everything so that when they walk outside that, you know, my office, they feel confident. They feel like they're going to make a good decision. And that's that, right? So that's how we started Rooted Apothecary with this goal. And I really wanted to go after moms. I really wanted to help moms feel comfortable in the decisions for themselves, whether it's stress, anxiety, depression, sleep issues, and for their kids. ADD, sleep issues, right? Skin issues, autoimmune, I mean, allergies, asthma. It's crazy. You see this stuff every day. Same thing here, you know? It just continues to get worse. So I didn't know this when I jumped into CBD, but those are all big no-nos. And we started the company in 2018 and it was going great. I think a lot of people were attracted to the message that we were talking about, our marketing, our packaging, you know, but everything changed in October 2019. We got a letter from the FDA and it was specifically for our formulas that were targeted for kids and for pregnant mommies. And we had a lot of verbiage on that because that's near and dear to my heart. Again, I've got a 7-year-old, a 5-year-old, I've got a 3-year-old and a 1-year-old. And it's amazing. And if we could teach other families, not just through the knowledge, but give them a natural medicine cabinet, a toolbox to help them be healthy, I feel like I've done my job. That's my purpose. That's my mission. I believe in that to my core. But the FDA doesn't agree, didn't agree with me. And so that was a scary day, Dr. Gator. That was a scary day when that letter came in.
What did they say? Were they saying that you, because a lot of the letters that I have read about for people that have products, it's usually around the wording that you chose, like using wording like treatment or implying or things like what was their issues with what you guys are doing? I'm curious.
So we worked with some really talented people, you know, legal teams to kind of help us, you know, navigate through this. And I think we were maybe judged a little bit harder, you know, based off of the counsel that we got because we had the pediatric formulas and the pregnancy formulas. So, you know, some of the things that we said, it really did our best to go through and talk about how these things may have been shown in this study with a link to it, or may have been shown to help or promote this, but never, you know, I don't think CBD is a cure. I don't think that. I've never said that to a patient. That's not what CBD is. There isn't a cure out there. Our bodies are the ones that are doing the healings, and that's doing the healing. But we firmly believe that your body has to remove a lot of the stress and the interference and the obstacles so it can do the healing, right? And we also have to give our body the right building blocks, whether that's through food, whether that's through, you know, supplementation, whether that's through sleep. All of those things are building blocks to promote health from the inside out. So we did have some claims on there, unfortunately, that we needed to clear up. We also had to remove pretty much anything that had a child or a baby or a pregnant mama, anything on there. But it's been hard. We've had to find a way around this. And so we can't talk about any symptoms. Can't say things like inflammation. It's wild to me how many other companies are saying these things. We can't say it. I know that our mission is to impact families. And if we're not in business, we can't impact families. So we've had to really back off, because I don't care how we get through it. I really don't, because our why is so important. We see, I talked with you about this 3-week-old baby Parker. And the first day that mom brings her in, mom is frazzled, fried, completely exhausted. Baby is crying the entire, 30-minute trip in to see us. Mom, I mean, they're just, I don't know. It's incredible to see the amount of stress, but when they walk out of the office, they're both completely different people. The energy has changed. And again, if we can do that for other families, whether it's through a product, whether it's through an article, whether it's through a video like this, whether it's through some type of referral, I don't really care how we do it, right? But we got to do it. We have to find a way through it. And that's kind of where we're at. We're still operating a little bit out of the fear. Again, I told you I was smiling through this conversation when you brought up the FDA, but my heart is still beating out of my chest. My hands are still shaking a little bit, but it needs to be talked about. And I don't think it's going to get better next week, or I don't even know next year. And the supplement industry, not just CBD, the supplement industry, the natural health industries as a whole. I mean, there's a lot of unknown for us right now, but people are hungry for truth. I think that's probably the biggest reason why you had such great attendance. People are hungry for truth. And when we share with them these timeless principles of health and healing, people attach to them and it resonates with them. And I know you experience that in your practice as well.
Yeah. And I just want to say, and I think, for me, this just gets to a much greater issue. If you're talking about the FDA, I know you're not against the FDA. I'm not against the FDA. Nobody is, right? They do lots of good, and they're there to protect consumers and protect products, and we need that, absolutely need that. And they do a ton of good work. And to me, what's frustrating on a much more macro level is just censorship in general, censorship on social media, censorship in natural medicine, censorship in a lot of arenas. And so it's about balance. It's about balance, and it's about fairness moving forward, because it just seems that there's this pattern moving forward of censorship in many areas, not just CBD, but all sorts of other things. And that is hurting patients, because it's not allowing people to get to the point where we can show something is very useful. How can you show a CBD does help with inflammation unless you can test it, use it, and see people actually doing it? And that's just puts you behind the 8 ball, because obviously pharmaceutical companies can do more testing. And if that's the only gold standard that you use, and it's important to do the testing, but you need billions of dollars to do what they're asking to be done. And that forgets about our history and our knowledge and what's been done for thousands and thousands of years. And things that have been done for thousands and thousands of years could be unsafe. So it doesn't mean you should just do something because someone did it 10,000 years ago, but it also doesn't mean that it's unsafe. And if Chinese herbalists have been using a Chinese remedy for 10,000 years, there's probably some benefit behind it. And so just to ban it just because there isn't all these studies, that also isn't right either, right? So we have to figure out a way to coexist. And that is what integrative medicine is. And that's really my mission. That's integrative pediatrics, integrative medicine. What I do every day is, look, it's not one or the other. And for whatever reason, we've become enemies almost. It's like they have become enemies, medicine and alternative medicine. But there is no alternative medicine. That's not a thing. It's not really a thing. It's just a made up concept to make an us versus them. But really, it's what's considered Western medicine versus what hasn't been proven in scientific method, or maybe it even has, right? There's lots of stuff that you're talking about. Like, okay, there's lots of studies that show CBD can be helpful in certain arenas. So should we give them a medication that has a long list of side effects, or should we try the thing that maybe isn't fully studied yet, but doesn't seem like it has a lot of side effects? Which one is better? And it's a really tough balance, because then it also comes down to quality, right? And that's also where you run into issues, and why I love Rooted Apothecary at companies such as yourself that have high quality products, small batch, things like that, because it's totally different. And essential oils runs into this, and maybe you can talk a little bit more about your company and the quality, because I think that's super important for people to understand too. But essential oils to me is the easiest example of that, because I just deal with it on a daily basis for kids, where there's all this information out there, but you shouldn't use this essential oil on your kids because it could be super dangerous, or there was one kid 20 years ago that had this problem. And it's like, you go, well, come on, like, who knows what product they were using? You don't even know if they had a problem with essential oil or some chemical or toxin in there, or was it just a crappy product, right? And that doesn't mean that you shouldn't think about that, but you shouldn't ban all essential oils because one product that was probably crappy caused a problem. And then instead of that, use medications. Like there's a middle ground there, right?
It's really wild. And again, I think that middle ground is probably easy for us to see because we've been doing this for a while, right? And we've been looking into it and reading the research and, you know, gaining more confidence as we work with people and see more positive results. But that narrative that people understand, you know, every time that they drive down the road and they see a CVS and a Walgreens and the products that are in there, well, you know, if it wasn't safe, then they wouldn't sell it there. So they jump through those things and continue. If we're not exposed to new things, you know, as a society, we're going to continue to get the same results. So, you know, at some point, we really have to open up the floodgates and let people start making the decision for themselves. It's not, you know, it's not a sales pitch. It's not, hey, you know, this is better than this, right? It's let's get as much information on the table as we can and let's make educated decisions. This, you know, an essential oil might be right today, but, you know, in 2 weeks, depending on where you're at, it might not be at all. It might still be the best decision, right? Things change. You know, but I think the part that's so interesting, you know, with CBD is that there is deeper science to show that our body has, you know, adapted and evolved, right? We're all hardwired with this endocannabinoid system. And, you know, I won't jump into that. I know that you and Dr. Krick had an in-depth discussion on that. And there's lots of information out there for people to understand. So this compound is a little bit different than some of the other natural things on the market. But yeah, it's such a big topic to jump into. And you know, the research, the anecdotal studies, or whatever you want to call it. It's just CBD and so many of the natural things don't fit into that pharmaceutical, peer-reviewed, double-blind, placebo study, you know, that, and it's hard. You know, if we're going to continue to have that as the gold standard, then, you know, maybe things will continue to be driven by synthetic medications. But when we start, you know, looking at things a little bit different, and that each one of us are different, and there's a lot of factors that go into health, I think there's opportunity for change and for us to get healthier as a whole.
Yeah, and I just even want to echo that. I don't even think that the research, you know, double-blind control, but shouldn't be the gold standard. I think it should be the gold standard. I think that is, you're going to get the best research available, but research is still research. It's not real life. And you can't research everything all the time. And it takes a long time to do research, and you can't only go based on research. And that's where I think, you know, we're just failing as society right now. And we're failing as, you know, allopathic medicine overall, is we're so dogmatic about one way, and that's not the only thing. It is important, but it's not the only thing that's important. And it's the very common story of, you know, whatever practitioner out there giving a child whatever, a homeopathic or a supplement or whatever for something very serious, and then the kid gets really sick, and then everyone's like, see, you can't do these things, you know, all natural medicine people are crazy, and you give them essential oil for their pneumonia, and then the kid, you know, dies or gets really sick. And that's horrible, but that's just not being a good practitioner. That's not what natural medicine is. It's, you know, for me as a pediatrician, okay, I do both, but the first thing I tell people when they're interviewing is it's a balance between the two, and you have to do what is most minimal on the day, but you also need to be able to identify when something is serious and outside of your lane. It's not the time to do something natural if your kid is having an asthma attack, right? You can do things with it, but there are medications that save your life. Both things are important. We have an emergency room. You don't, you know, do some sort of voodoo dance to diagnose your knee break. You go get an x-ray. I mean, that's what we have that great technology for. But it's both, right? But after you get your knee examined and you get stabilized and you do whatever you do, then maybe there's some natural things that could help you get better. Maybe there's something that can help you from pain, so you don't have to take an opioid medication and get addicted to opioids. Maybe there's an alternative, but if those alternatives are not options, then you have no choice. And also physicians have no choice. And this was the thing that I would say for me during my training was the absolute most frustrating was I didn't know any of this stuff back then. And so your only option is medication, because that's just what you've been trained. So somebody comes in with their kid and their kid is sick or in pain. What options do you have? You have antibiotic, Tylenol, Motrin, it's a virus, it'll be fine. That's what you have, right? And if once you start learning about natural remedies, then there are other options that people can do, because parents do not bring their kids in to see me. They don't bring their kids in to see you for you to say, oh yeah, it's fine, don't worry about it. It'll get better. Like, they want to do something. Sometimes maybe what you do is placebo, but placebo can be good too. Sometimes it's really helpful, but it's a balance. And if we don't balance the world back to where we are, we're just going to be treating with pharmaceuticals for everything. Everyone's going to be on 20 medications, and we're giving medications for their side effects. And that's where adults are, right? I mean, we're 50% chronic disease plus, and many of those are on more than one medication. That's not a good life.
Yep.
That's not what we should be striving for. If we need it, great, but we shouldn't be striving for that, right?
So I'm just giggling over here again, like, I don't know if we really need to have this conversation, Dr. Gator. I mean, so much of what you're saying is just so simple and so common sense. I don't, it's kind of silly to have these conversations, but it's the truth. They need to be had. People need to hear it because they're so used to only hearing that one solution, one pill for an ill, right? And that, if you've got high blood pressure, we've got a pill. If you've got low blood pressure, we've got a pill. It's a pill, it's a pill, it's a pill, right? But there is a different world. And I think some of the most skilled practitioners understand that toolbox, that spectrum is so widespread. I think the most skilled practitioners also communicate with their patients and give them the options to make the decision, right? You could do this, and here's what the option is. You can do this, and here's what the option is. This makes most sense to me. What's the decision? This is your health. This is your decision, but we're going to equip you with those tools to make the best decision, right? But, again, it's just these things are so common sense. But I also just want to say again that when you speak, you're speaking that from a skilled physician. You're speaking truth. You're speaking something that resonates with people. I know that the people that listen to this understand exactly what you're saying. And I just have the utmost respect for that, what you've been through and the decisions that you've made for your practice. And again, sharing that information beyond your practice. It's just amazing.
Thank you so much. And I get echoing that again. Doctor means teacher, right? That's what it means. You're not here to tell people what to do. For the most part, if somebody's super sick or there's something very serious, and sometimes you got to take control and you have to say, like, this is what we need to do. Your kid needs to go to the hospital. But other than that, and that's a very fine amount of times, you're supposed to teach people what to do. You're supposed to explain to them their options and not say, this is what you have to do. Here are your 5 options. Here's what I think is best based on the research and my trading. What do you want to do? That's what medicine always was, right?
It's a different world these days. Now, when I came out of school, I didn't understand that. And I was told by a couple different mentors that wasn't the way to do it. And practice, I kind of lost myself. And I almost lost my practice because that was the world that I was living in. And practice got fun again. I was able to be me in practice again when I understood that my job is really simple. It's simply to share with people what I know. That's it. My job is not to make the decision for that patient and not to take it personally when the patient doesn't choose what I think is best for them. I get to share with them what I know, and for better or for worse, that patient gets to decide for themselves. And practice got fun. And again, now we're doing our best to take that, to Rooted Apothecary. It's a different way than what I know here in my practice. And, it's a lot of learning curves and some roadblocks along the way. But again, I know that when I get to team up with people like you and Dr. Jockers and Dr. Krick, the wonderful members of our medical advisory board, it's inspiring. And I know that we're doing something bigger than ourselves, and we're showing people the truth that there's a better way, that our bodies are meant to be, healthy. That's our natural state. And we can do that when we get rid of so much of the confusion that's out there, so much of the chaos, and we come together.
Let's finish up, but what's the current state of CBD and where things are in terms of what you can and can't do? I mean, we talked about some negatives, but what's some of the positives? Where are things going, and what have you seen from a positive standpoint in terms of Rooted Apothecary and just that topic in general?
So you, and I smiled when you said this, you had said that you're thankful for the FDA, and I am too. There's been a lot of cases that the FDA has gotten rid of some dangerous products that are on the market, some things that were labeled as such and were different when they were tested. So I think, having a lot of these regulations and, rises all ships, right? So the consumer knows what they're getting and they can be promised it. So I think that that's phenomenal. However, there's still a lot of companies out there making claims. There's still a lot of companies out there doing things that they shouldn't be doing and not following the rules. Then there's still, I don't know, I guess I'd say it's still kind of the wild, wild west, if you will, right? And so, for us, I think I've kind of backed away after dealing with the FDA thing. I'd say for maybe 6 months, the amount of fear, the unknown, the mixed emotions of wanting to just hang my hat and say, I'm done with this and go back to what I know. be here in my practice. I've kind of stepped away from keeping track of what's happening in the legislation and legally. And that's probably not the best thing, but I have to also watch my heart and my mental well-being. And so I've really put my head down, working with my team and working with my medical advisory board to, really put content out there, really make sure that we're, doing things above and beyond. We're providing the best customer service. We're providing cutting edge, products that are innovative and really help people fill that natural medicine cabinet, provide the solutions for them. So that's really where I've been backing away from what's going on and the who's who and things like that. But I don't know how to answer that in because it's changing every day, Dr. Gator, to be honest with you. And you know that. But when we back up from that, forget it. Our bodies are still hardwired to have an endocannabinoid. So that hasn't changed. So let's stick with that. Let's stick with what we do know. And let's get away from so much of the unknown and the fear and the stress. So that's kind of the world that I'm living in now.
I couldn't agree more. I think that everyone has more than enough stress right now. We don't need extra stress. That's for sure. And so I think that, we need to just keep moving forward, and the goal line does keep changing. There's no question about that. But at the same time, everything's a pendulum, and the world balances itself out, and hopefully over time. And I, there are negatives and positives, and there's lots of positives. And so hopefully as we move forward, we're going to continue to see those positives. And it sounds like you guys are moving forward amazingly well. And I love everything that you guys do. And then that's why I wanted to chat with you, because I think it's just important to talk about these things more. And people are, always ask questions about this kind of stuff, and what is working and what's not working, and where we're going next, and supplements and CBD and all this stuff. We just need to talk about it more.
It's never ending. It's a constant learning curve for us, as physicians and doctors. And, I think it's just so overwhelming for parents to jump into it. So, we put our heads together and we create something like the summit or these types of videos. We give parents a very straightforward path, a way that they can be confident in making better decisions for their family's health. Again, Rooted Apothecary is really our mission to connect families with a healthier natural medicine cabinet, and one that they can trust. And so we do that with great products. There's just only so many ways that you can do it, that you're checking all the boxes. But when we provide that with content like this, I think that's the game changer for us, is that people can go through and they can learn a quick protocol. We've got plenty of articles and stuff that we've shared from you on teething. And I don't even want to get into symptoms, right? But, on all these things, that sleeping things and all these things that parents struggle with. But it's simple, it's straight to the point, and people leave, okay, I'm confident that I can do this. We're not a cure, but CBD deserves to be a part of that medicine cabinet for families. And it's pretty cool to see what families have done with it and how it's helped them.
Yeah. And I think I want to add to even what you said, that, sometimes these videos and these chats help people to get the best information. But I think also sometimes it helps them to realize that even we don't know a lot of this stuff. There's stuff is changing, and we don't know always what's going on. And I think it makes parents feel better too, to know that, just because they don't have all the answers, well, nobody has all the answers, because many of these things don't have answers. It's science is continual learning. Right? That's what it is. We learn something, and then we test it again, and then we see if that test is right, and then we keep changing things and just making it better and better and better. And so, for the parents who are watching this, don't feel bad if you feel like you don't know everything, or should I try this, or no, go with your gut, talk to your practitioner. That's what your practitioners are for. If you're thinking about something like CBD, talk to your practitioner, see if it makes sense for you, see if it's going to be a reasonable choice, and then go from there. That's what we're here for. And we'll have, whoever you're working with, we'll have hopefully a good chat with you about it. And then, like everything else, if you're going to do it, you try and you see how it goes. But, that's what your practitioner's for. Talk to them about this or any other supplement or anything really. And that's why we have these conversations, because we want you as parents to be educated on the options that are available to your family, to yourself, to your kids. So that way you can have intelligent discussion. Even if it's a regular Western doctor who doesn't know anything about integrative medicine, the more parents that ask some questions about that, and the more we're going to learn about it, because I can guarantee you that there are so many Western doctors that are starting to learn about some of these things. Yep. And something even like CBD, it's Western now. It is. It's this treatment for seizures. It's FDA approved medicine, on some levels. So everything moves as things move. And willow bark is aspirin, right? Things are natural until they're not. So the more that people are interested in these things, then the more it's going to push everybody to learn about it. So anyways, that's my story. Thank you so much for chatting, Dr. Cade. I think, I really appreciate you being honest and open and chatting about some of the stuff. It's tough things to talk about, but I think a lot of people are going to really appreciate that you were willing to be vulnerable and chat about this stuff.
Well, if anybody ever has more questions and wants to know more or anything else, they can always reach us on our website. But, I'm so thankful to be partnered up on you with this mission. You're doing wonderful things, and the way that you go about it is pretty dang cool. You create such a safe space for conversations like this. And I think, parents really learn from that and are able to walk away with it. Instead of, again, being told what to do, you're really just opening up the door in such a beautiful way. So I appreciate you. And again, it's an honor to be walking this journey with you, Doc.
Thank you. Thanks so much, Dr. Cade, and everybody. Check out Rooted Apothecary. It's great stuff. All right. Have a good rest of the day.
Thanks, man. Talk to you soon.